Feeling exhausted, gaining weight, low libido, brain fog, your hormones might be the problem.
So we're going to show you what hormones we test, why they matter, and how optimization can help you. I'm Eldon, nurse practitioner with Elite Medical Ocala.
And I'm Chris, nurse practitioner here at the Elite Medical Ocala.
Hormones control everything. Literally, testosterone is in every tissue of the body. For example, I had this young gentleman in his 30s. His testosterone was below 100, very low. His symptoms were fatigue, low energy, low motivation, low metabolism, weight gain, low libido. All those things were affected, at a young guy at the age of 30, that's a big deal.
Yeah, testosterone is very important, but you also have to look at estrogen and progesterone also. So those things affect bone density, the way you sleep, muscle mass. All of those things are affected by hormones. When your hormones are off, your entire body suffers. So here at Elite Medical, we check comprehensively. We optimize, not just treat disease.
So for hormone replacement, for men and women, what do we check for? So we're gonna check for testosterone, we're gonna check for FSH, LH, estrogen, the total and free testosterone, sex hormone binding globulin, DHEA. We're gonna check comprehensively the hormones that can affect you. We see men in here all the time for low testosterone and some of the symptoms that they're having. What are some of the things they're saying?
I see a lot of guys and girls who are also going through this, and we treat both, but they're usually coming in, muscle mass has declined, increase in belly fat, sleep is poor, brain fog, for guys, erectile dysfunction, things like that.
Yeah, and I think it affects psychologically too. Anxiety, depression,
Absolutely.
things like.
Some of the other things we test for, Hemoglobin A1c, that's a 3-month check of your blood glucose level, which indicates diabetes. Also, insulin resistance. Insulin resistance precedes diabetes by many, many years. These things can also affect some of those same symptoms that you're having. We also test vitamin D. That affects immune function, energy, bone strength. So it's important here at Elite Medical, we test for all of these things. So we have a comprehensive plan of what we're doing.
Yeah, and when we get the results, what happens after that? We're gonna bring you in, we're gonna go over everything with you so that you have an understanding of what's happening in your body and how we can help you. And from these results, we're going to come up with a plan to help optimize your hormones to get you out of this feeling sluggish, brain fog, and all these other symptoms that we've already talked about.
After we we discuss all those things, we develop a treatment plan. Sometimes that does involve hormone replacement, sometimes it may not. But if it does, again, we're gonna optimize levels using medications. We're also gonna look at lifestyle changes also. Exercise, nutrition, things that can naturally boost our testosterone levels, estrogen levels, and things like that. We can also prescribe certain supplements that can naturally boost your testosterone levels, not just injections. So we know DHEA, which is a precursor to some of these hormones. Sometimes you may just need a little boost in that also, but we also check that level.
And with this optimization, we will check in with you every month. We will retest your levels every 3 to 6 months to make sure you're optimizing and getting into the therapeutic levels of testosterone. That patient that I had mentioned earlier, where his testosterone was below 100, young guy, we optimized him around 1,000 and he feels fantastic. More energy, sleeping excellent, everything else feels amazing. He feels like he should at 30 years old. And that's just ultimately what we're trying to do. Testing is the beginning, optimization is the key.
So who should get tested? If you're over 30, you have any of these symptoms, fatigue, libido issues, muscle mass decline, increase in belly fat, any of those things, come see us, we'll get you tested.
Yeah, and this is available for men or women. Just come onto the office, look at our website, see where we're at, give us a call, and we can get everything started for you.
Yeah, and the good thing with us too is once we get you in, get you situated, and we prescribe these medications to you, they can be shipped to your home. You can come to the office with help with injections, or you can do them at home by yourself. So don't accept these feelings of brain fog, low libido as just getting older. Hormone optimization works. We see it, we change lives every day.
There's another medical model that's changing the way people seek healthcare. Do you ever struggle with insurance companies, have difficulty with them getting to pay for visits or unable to get into the doctor because they don't take your insurance? Well, there's a medical model now in Ocala that's really changing everything, and that's called direct primary care. And in the next video, we're gonna tell you all about it.
Feel elite.
Be elite.